Hi everyone, my name is Tabitha, and my group decided to do the current event article on the measles outbreak in the US. So the article is What to Know About Measles Symptoms and the Vaccine, published by the New York Times. The date of this article was February 9th, 2026, and it was by Danny Bloom and Teddy Rosenbluth. To begin, let's take a look at why measles has become a major public health concern again in the US. In 2025, the U.S. experienced its largest outbreak in recent years with more than 2,200 reported cases. By early 2026, however, hundreds of additional cases have already been reported, showing that the outbreak has continued into the following year as well, with it having a lot of outbreaks still happening. The measles outbreaks are centered currently in South Carolina, Utah, and Virginia, with additional notable clusters in Texas, Florida, and Pennsylvania. The majority of these cases occurred in people who were unvaccinated, and many involved children. Certain groups, including infants, pregnant women, and individuals with weakened immune systems, are especially vulnerable because they are more likely to experience serious complications from the disease. This story became national news because measles is one of the most contagious diseases in the world. Public health experts have linked the increase in cases to declining vaccination rates in some communities, making it easier for outbreaks to continue to spread. The key takeaway here is that when vaccination coverage decreases, diseases that were once largely under control can return, creating a significant risk for individuals and communities alike. Now that we've introduced the current measles outbreak and why it has become a significant public health concern, Avery will explain the disease itself, including how it spreads, who is most at risk, and how trusted scientific sources support the information presented in this article.
The Cleveland Clinic reports that measles are caused by the measles virus, which belongs to the genus Morbillivirus. Building on that, our article states that measles are spread when infected individuals cough or sneeze, releasing viral droplets that can contaminate surfaces and remain in the air for hours. When others touch an infected surface and then touch their eyes, nose, or mouth, the virus can enter their body. Measles can also be spread days before an individual even shows symptoms. In addition to how it spreads, it is important to understand the symptoms. The Mayo Clinic states that measles symptoms typically begin to appear around 7 to 14 days after infection. Early symptoms can include a fever, dry cough, runny nose, and red, watery eyes. After 2 to 3 days, Koplik spots, which are small white dots inside the mouth, can appear. Then, about 3 to 5 days after the first symptoms, a rash can develop, starting on the face and neck and gradually spreading down the body. Because of how contagious it is, certain groups are at higher risk. The CDC confirms that anyone who is not protected against the virus is at risk, but especially children under 5 years old, adults over 20, pregnant women, and individuals with weakened immune systems. Overall, measles is a highly contagious disease, but the point is that it is also preventable, especially through vaccination and proper public health measures. Now that we have a better understanding of measles and have verified this information using reliable scientific sources, Dylan will discuss how public health officials are responding to outbreaks and the strategies being used to reduce its spread.
What is being done about the outbreak? Public health departments such as the CDC are urging people to receive the MMR vaccine to help reduce the outbreak of the measles. The number of people per state who are diagnosed with the measles are also being tracked for investigations to help determine where exposure is most common. Is this approach working? The approach of public outreach is helping prevent the spread of the measles. How can the public help? There are many ways to stop the spread of the measles outbreak, including staying up to date on the MMR vaccine as well as self-isolation as the measles is airborne. The MMR vaccine is a shot that protects people from not only measles but also rubella and mumps. The public can help stop the spread of the measles by staying up to date on their doses of the MMR vaccine. According to the CDC, receiving just 2 doses of the MMR vaccine is equivalent to being 97% effective at preventing the disease for life. Now that we've gone over the public health response, Jalen will explain why the measles outbreak matters beyond the current cases through impacts such as prevention, community, and healthcare systems.
Now that we've explored the public health response, I'll discuss why this measles outbreak matters and its broader impact on public health. This outbreak is important because measles spreads very quickly, especially in communities with lower vaccination rates. It puts vulnerable populations, including infants, pregnant women, and people with weakened immune systems, at a higher risk for serious illnesses and complications. Measles outbreaks also affect healthcare systems by increasing the need for testing, treatment, contact tracing, and public health resources. In addition, outbreaks can disrupt schools and communities as officials work to prevent further spread. Looking ahead, this outbreak reminds us that preventing future outbreaks requires both individual responsibility and community-wide public health efforts. Staying up to date on vaccinations, educating the public, and responding quickly to cases are all essential for protecting our communities. In conclusion, while measles outbreaks can be concerning, they also remind us of the critical role that surveillance, public education, vaccination, and rapid public health response play in protecting our communities. By working together to prevent the spread of infectious diseases, we can reduce further outbreaks and improve public health outcomes.